What's up, guys? Welcome to Coverage Podcast with your host, Matt Sartrick, and myself, Peter Findra. It's a podcast where we tackle current health news and hot nutrition topics, one conversation at a time. Thank you guys for tuning in. Thank you guys for all your comments, all your subscriptions. Thank you for being with us. Thank you for following us. We got a lot of stuff coming up for you guys. We're going to keep it on the DL for now. But how's it going, Matt?
Good. I'm having a great day. I'm ready to get the show started, and we have a special guest today. His name is Luke Zborek, and he is a medical student, not from this country. He's actually in Europe. He did his internship part in the United Kingdom, and he's finishing up his other part in Poland, correct?
That's correct. I'm done with medical school, though, so I'm not a student anymore. But
you must feel excited, man.
Yeah, it's great.
So give us a little intro of kind of who you are, what you have been doing, how you kind of decided to do your medical student stuff and what is it called in Europe?
In Europe, yeah. So I'm from Chicago, so that's how I obviously know Matt and Peter. Born in Chicago. I went did my undergrad at Northwestern. Had a math major and I did pre-med. So I combined my two passions that I was interested in. And then I applied for medical school. I had a few friends studying in Poland, in Kraków, so it was very enticing. So I applied there. It was a lot cheaper. The cost was a very big factor for me, my family. And I applied for a 4-year program in English, which is what we do in the United States, 4-year programs in medicine, which is different from Europe where it's a 6-year program. So I did my medical degree in Poland. I moved to the UK. I did part of my postgraduate internship as a junior doctor, as they call it, in England. I worked 1 year in the UK. It was enough for me, and I'm finishing up my internship in Poland. I'm finishing up in less than 2 months. So that's me in a nutshell, and then I'm going on from there. So
what made you become like a doctor? Was there like one event in your life that kind of wanted you to pursue the medical field, or did you just like the aspect of being a doctor?
I think there's a lot of things that drew me to the field. Healthcare is obviously, as you guys know, you work in healthcare. It's a very fulfilling field. I like working with patients. I was very interested when I was in undergrad. I did a lot of volunteering at a community health clinic. It was called Community Health in West Loop, West Town, by Ukrainian Village. So it was a good experience. I got to see a lot of patients, a lot of work with a lot of med students and doctors as an undergraduate student. So that kind of drew me into the field, the medical aspect, and then also interacting with other people, helping other people, just getting the full picture of medicine. So that kind of drew me into the field.
And you said that you had enough in England and you went to Poland to do that internship. Yeah. So what was like the biggest factor of being like, man, I got to go switch countries in a way?
Yeah, I guess like England, I liked living there. They had a lot of stuff going on beyond the hospital. It's an interesting place for traveling, and they have a lot of beaches and live music, and their music scene is really, really good out there, nightlife and all of that. But in the hospital, I guess it was a very different system than it is in the US and in Poland. There's a lot of factors that, I guess the main thing being, it's very understaffed in terms of doctors and nurses. They lack a lot of doctors and nurses out there. And then it was really chaotic. We were working on call and staying super late. When our shift was ending, we had to stay like an extra hour and a half on a regular basis just to get all the work done. And there was a lot of factors, and I felt like the lifestyle, it was a bit chaotic and not worth it for me. I didn't see myself there for the long run. So it was a good experience, and I got a lot of good training out of it. Clinical training, like I mentioned earlier, doing bloods and putting in IV lines, because we had to do that. The doctors were expected to do that instead of the nurses in many cases. So there was a good clinical experience, managing a lot of patients, writing discharge summaries, admitting a lot of patients, managing wards and bays of patients. So I think in that regard, it was a good experience. So yeah, I enjoyed that part, but I decided it was time to move on after 1 year.
What are some common issues that you like saw in England or you see in Poland?
Common issues in terms of working. I would say, yeah, some of the staffing issues were really big. Obviously, in Europe, in the UK, healthcare is free, so everything to get all the patients, you don't have to pay for anything. When you go to the ER, when you get scans, X-rays, CT scans, it's all free. So so that's a big difference, I would say. And so yeah, I think the level of care there was a good level of care for the most part, but since it was a free healthcare system, there was not enough money going in, so there was not enough doctors and nurses, and sometimes supplies and things like that. So
did you see a lot of people come in that necessarily didn't have to see like a doctor? They just came in just because it's free and they had that opportunity to come in.
Yeah, I saw that a lot. The emergency room was clogged with people that came in for like random stuff. Like we had one guy, I still remember this case, who came in because he had problems during defecating. He had pain with giving stools. And he's like, yeah, it kind of hurts a little bit. On a scale of 1 to 10, how much does it hurt? Maybe 1 or 2. So my senior, my doctor I was working with, he was like, this guy needs to go see his GP. He's clogging up our emergency department. It's not necessary. So things like that were kind of.
Have you worked with any nurses in the United States when you were here at all?
A little bit. So when I was still a medical student a few years back, I did a few electives in the United States. I did a couple in Chicago at Loyola and UIC, and then I did one in Tennessee. So I worked a little bit with the nurses. I had a good experience with them overall, I would say.
Would you?
You better have.
Yeah. I would say, can you notice a difference in nursing compared to United States, like UK or Poland?
A little bit. I would say probably the UK and the US nursing system is very similar in some respects. But I think the big thing that I noticed in the UK, which I was shocked when I went there, is that some of the nurses that work there, not all of them have certifications to take blood samples and to put in IV lines. So you had different levels of nurses. In England, they called them like band 1, band 2, all the way up to band 5 or 6. And you would have to ask them, do you have papers or certification to take blood or put in an IV line? Do you have one? Do you have the other? Just to make sure. And if they didn't have it, you would have to take the bloods and put in the IV lines. So it was really, you had a lot of stuff on your plate, and then doing all of this other stuff made it really chaotic. So I think that was the main difference.
Yeah, because I can't imagine like me calling physicians to put like a peripheral IV in. Like no way, that'll never happen. Like I'm sure some physicians do it just to like help out, but like I feel like that's something that we just take like as a standard practice. Like we're nurses, we should be able to put IVs in.
Yeah, exactly.
Did you notice anything different with like school? Because you both went to Northwestern and then you did school in the UK.
In terms of schooling abroad.
Yeah, like is there like, are the classes kind of the same? Are they like taught the same way? Any kind of like differences?
I would say it's fairly similar. Although what I did in the US was undergrad, and over there I did medical school. I mean, here in Europe. I would say it's fairly similar. I would say during your like 3rd and 4th year in the US, you have a lot more clinical work. You have a lot more clinical experience, I would say. And in Europe, it's more theory. It's very heavily theory based in your schooling, I would say.
Interesting.
Hopefully nurses from this show don't go to Europe now, because they get to find out that they don't got to draw their own blood out there.
Yeah, that's actually specifically in the UK. In Poland, the nurses are amazing. Like they get all the IVs, they get all the bloods, and like doctors in Poland, in the US as well, they de-skill in taking bloods and cannulas or IVs because they never have to do them because the nurses are so good in the US and Poland. So
how is healthcare like in Poland? I've been to a hospital once there. That was while I was on vacation. I had very bad stomach pains. Instead of doing a CT scan, this guy wanted to do an EDG right away. Meaning for those that don't know, put a freaking camera down my esophagus to see what's going on. So I refused that, and I was like on observation for a day, and I just signed myself out.
Mm-hmm. Yeah, so I guess people have different experiences, but the hospital I work at, sometimes, I would say in the emergency department, they do a lot of the standard CT scans and X-rays and all of that. I don't know why the guy, he maybe suspected like an upper GI bleed, and he wanted to go straight for the scope and see where the bleed is. So he didn't want to mess around with the CT scan. So maybe he had some sort of strong suspicion of an upper GI bleed. But I think overall, it's not the same as the U.S. or there's some differences. It's a free healthcare system as well here in Poland, so the patients don't pay for anything. So again, you don't have that inflow of money coming in as in America, where you have health insurance and a lot of people paying in a lot of money into the healthcare system. So sometimes, you might have to wait a little bit in the emergency department and things like that.
Do you think they're more? Do you think they're more cautious with giving out tests in that case? Because there's an ER doctor, for example, he's known for everybody gets a CT scan. Is it a little bit different in Poland because of this open healthcare, where doctors are hesitant to maybe draw labs or do tropes or whatever the case might be, and like any expensive tests?
Mm-hmm. I would say, blood tests and tropes, they do it quite readily in the hospital. For imaging tests, I would say, if you have someone coming in with a loss of consciousness and head injury, trauma, they do a CT scan right away. So it's not different. But I guess you can say that in some cases they're a bit more cautious about what kind of tests they do. Especially in England, I saw this in England all the time. They were very, very cautious with what tests they would do because they wanted to be as cost efficient as humanly possible. So they were really, really cutting it close in England, like in many cases. What I noticed when I was there, like, don't do this test unless it's absolutely necessary. We have to save the hospital, costs. We have to cut back on costs. We have to do this and that. So it was a very common theme over there. So I would say it's a little bit different in Europe versus the US in that respect.
I guess no matter what health system you have, there's always cost cutting going on everywhere. It doesn't matter if it's government run or private.
It's common.
So I was going to ask him, but I completely blanked out. So a really good question.
Yeah. I'm wondering, other than like the fact that it's an open healthcare system, what else do you think is a huge barrier for healthcare for your job? What is the barrier that causes you to have an issue like, damn, I can't do everything I want to for this patient? What's like the hurdle that you have experienced?
I guess, there's a lot of factors, but like you said, some of the imaging tests, ordering all of that. Also like making sure your patient has good follow-up care in the community. So it can be difficult for like older people, to have care at home and things like that. So just like things in the community, they have community nurses and all of that to help patients that are stuck at home or people that need help with wounds, dressings of their wounds, and INR checks, people on warfarin and stuff like that. But like, I guess some of the social aspects, old people and nursing homes and care and things like that outside of the hospital.
So follow-ups and like prevention medicine in a way, right? That's neglected a little bit.
Mm-hmm.
Have you experienced like anything with like the virus? Like how do you guys treat it if you dealt with it? Is there like a PPE shortage? How is like that doing in Poland?
I think overall, I was surprised we weren't that hit as bad as other countries. So Poland was they took things really seriously. So in March they had a full lockdown, and yeah, they shut everything down. The border was shut down. We didn't have any tourists coming in. You couldn't even go from one county to another county. You were basically stuck within your own state or county. You couldn't move and travel freely through Poland. It was very, the quarantine was very strict enforced. So if you had COVID or if you were in quarantine, you would have, it was very advanced. I was surprised. You would have a couple things. You would have a police officer come visit you every day and check up on you, make sure you're at home. Or the other option, most people had this, you had an app on your phone where you had a location setting on this app and they would track your location. So you would get a message from the police or from the health agency, and they would basically ask you, please send us a picture of yourself in 1 to 5 minutes. And you would have a picture of yourself at home, and you would have a picture or something that they would know that you're at home. They would receive this photo. They would have your location as well on the app, so they would know, okay, this person's at home. Okay, so we don't have to go check up on them.
Wow.
Man, that's crazy. Holy shit.
Yeah,
talk about privacy.
Sorry.
Let's talk about privacy. Like holy shit, out the window.
Yeah, exactly. So yeah, it was intense. I didn't have to quarantine or do anything like that, but I've heard from people that this was the case. So we had very little cases. The hospital. So in Krakow, they built a brand new university hospital. It's the biggest hospital in Poland. They built it in December of last year, so it was perfect timing. So as soon as COVID hit, this brand new hospital was ready to go, and they made it this hospital the designated COVID hospital for Krakow. So it was good in that respect. PPE was there may have been some shortages at the beginning, but over time there was enough masks and gloves and gowns, and everything was pretty good. I would say it wasn't that crazy as in other places.
What's the treatment modalities that you guys have been implementing for COVID? So my question is for a regular patient that is just having flu-like symptoms, and then somebody a little bit more severe. Because I worked in the ICU for 3 months, so we did anything from, remdesivir, clinical trials, IV. I think there was Saramulab, whatever. So that was the medication that was getting clinically tested to prevent the cytokine storm. Then there's the Plaquenil, of course, with azithromycin. So I'm curious on how you guys have been, treating the virus out there and things like that.
Yeah, so the hospital I worked at, we didn't have any COVID patients. All of them were sent to the designated hospital. So I didn't work on any COVID patient wards with COVID patients, or it was all in one hospital. So I didn't have that much exposure with COVID patients, luckily. But yeah, they would do supportive treatments. Obviously stay at home if you're not feeling very unwell. If you would be unwell, they would send you to the hospital. Obviously, you would have the ICU ward, the internal medicine ward. And I'm not sure what stage they were with trying out different drugs, like you mentioned, the monoclonal antibodies, the antiviral drugs. So I think it's a changing field and it's developing rapidly.
Mm-hmm.
So
yeah, that's very interesting. How is like the lockdown going over there? Is there, because here in California, it's well, not here, we're in Chicago, but in California it's still a lockdown, so you can't do gyms. Restaurants are barely open. They do the curbside pickup. But here in Chicago, you could go to the gym. You just got to wear a mask. You can take it off when you're there. You could go to restaurants, but you got to maintain 6 feet distancing. So how is lockdown over there? Is stuff still closed?
So it was fairly closed in March, April, May, and then in May they started opening up. So in June, I think it was June or July, all the gyms were open, all the restaurants are open. Bars are open, everything's based, even, so a lot of places, even some of the clubs, they've rebranded as cocktail bars. So they're open. So everything basically opened up recently. They opened up the borders, so there's people coming in from different countries, tourists and all of that. But we've had a spike in cases. We've had a lot of cases recently this month and end of July. So we'll have to see how things go. If it doesn't go down, they might have to impose another lockdown or step down on the scale that we've been using to monitor the situation.
Are masks still required everywhere?
Masks are only required in restaurants, in hospitals, in buses, in public transportation, churches, things like that. So in public, you don't have to wear a mask, and no one wears a mask. If you're out and about in the evening, or by restaurants and different venues, people are not wearing masks, so it's very different.
Okay. Do you pay attention to like politics at all? Because we have an election coming up in here, and Poland just had an election as well. Are you in tune with that kind of stuff?
A little bit. I haven't been following it that much, but some people were saying, like the numbers were looking really good before the election, and then afterwards, you had a lot of cases. But I think it's because they opened up a lot, and there's a lot more people moving around and less restrictions and things like that.
I'm sure Polish people have their own little conspiracy theories that this happened.
Oh yeah, they're definitely out there. There's a lot of conspiracy theories, as with anything, and everywhere you go, right? So
what do you think is going to be your next step when it comes to residency or whatever? Do you want to just be a medical doctor, family practice? Do you have a plan on maybe specializing?
Mm-hmm. Yeah, so I'm debating. Yeah, so it's I'm debating working on contract for a little bit right now in October. So we'll see. That's one of the options. Residency wise or longer term, I'm thinking of family med, emergency med, so primary care, more or less. So yeah, that's the next step, I would say. And we'll see where that is.
Yeah. Do you do nights now, or do you do days, or do you have a rotating schedule?
It depends. It rotates. It's usually days and evenings. No nights at the moment. Luckily,
man. Freaking
yeah. Nights are insane.
And are you there every day?
For the most part, yeah.
Damn, I can't imagine being nights every day. 3 nights a week I could do, but if I had to do 4 nights or 5 nights, I'd be.
Yeah. In England, that was very common. You would have nights 5 or 6 days in a row, 4, 5, 6 days in a row, crazy stuff like that. Damn. And it's insane. I've known some residents there that were working on contract as well, and they would be doing nights for a whole month, just 4 nights, 5 nights a week, and just crazy. These rotas and schedules were really intense.
Yeah. The family medicine route that you want to go into, does that involve you having your own clinic and having your own patients?
Yeah, it's more of an outpatient setting where you work in a clinic, outpatient, see your own patients. But yeah, you can do a few things with that. You can combine it a little bit with emergency med. You can combine it with sports medicine, see mostly patients that are athletes or high school athletes, things like that. And especially if you're in a rural setting, you can do more with that. Do scopes and GI things, and like you guys were mentioning earlier, colonoscopies and all of that. So there's a lot.
Is there something you would change in your profession if you can, or someone that you kind of preferred somewhere else, like in the US or UK? Is there anything that you dislike about your field, basically?
Okay, anything. I think there's a lot of paperwork, a ton of paperwork. So you have to get used to that. So you spend a lot of time in front of a computer screen or in front of your paperwork and less time with your patients. So I think that can be a bit difficult. And obviously it's important to have clinical experience. So for people that are, students or getting into medicine, it's obviously important to see as much as possible and kind of get a scope of what the job looks like. So I think that's really important.
I think ER is one of those fields for MDs that don't they have a scribe usually that follows them when they're seeing the patient and they're typing everything out and all the doctor does is just signing it?
Yeah, it's really common in the US. Yeah, they have that. So in the US, you have scribes and especially, like you said, emergency medicine. You have special devices that you can record your patient notes. So I saw this a lot in the US. I was working with an orthopedic surgeon, and every operation is very similar. Knee replacement, hip replacement, it's the same procedure. So they just kind of say the whole procedure to this recorder, and you don't have to type it up. So it makes life a lot easier. Some of the recorders have preset prompts that you just fill in with patient information and things like that. So it makes it quicker. So I think that's good. It's helpful. They don't have that as much in Europe. I haven't seen it that much.
What's like one of the craziest cases you've seen?
Craziest cases I've seen.
Yeah.
Story time.
A story time?
Yeah, or just one you enjoy doing. Doesn't necessarily be crazy.
I guess in the emergency department, you see a lot of people, a lot of crazy things going on. So you have your people with alcohol problems, people that are high on drugs, and you just get different characters. A lot of car accidents, I would say. Yeah, it's hard to think of one patient, but
Have you been seeing a lot of codes as well?
we had a couple codes. Yeah. There was one guy that arrested a few months ago, and an older patient, and the nurse, I think at first she thought the patient was dead, and the senior comes and he's like, he's not dead. Well, what are you talking? Like, what's going on? And then we ran the code, and we brought him back like in 5 minutes, 6 minutes. So it was a great, it was a good experience. Every time you can get a patient back, it's fantastic.
Do you know how they recuperated? Like, have you looked back on them, how they are post code? Because a lot of times, like, we feel great that we like revived this guy like perfect. We did like a 5-10 minute code and he's back. But then, like, a lot of times for me, it's like you look back on the patient, you're just like, damn, this guy's been in the hospital now for a month, and with a hypoxic brain injury, and there's nothing that we could do about it.
Yeah. So I don't know what happened to this patient. All I know, he was stable after the code, and he was fine. And then I think he was sent home in a few days, but I lost track of him, unfortunately. I hope he's doing well, but yeah, we have a high volume flow in internal medicine. You see a lot of patients.
It's nice to kind of like see how they're doing sometimes. So we had a patient that was, I believe it was open heart, and he coded at one point. We brought him back, and I was there as well helping out. And a year later, the patient comes and visits the hospital, and he's like, like, what's up, guys? And, Jess was there, and she took a picture with him, and she sent me the text message. I'm like, that's freaking awesome that, like, a patient follows up and is thankful. And like, sometimes you need to hear those stories too, because as you know, like burnout and everything else, we always talk about it, stress, and we're just flying through patients. So are you, man. Like, there's so many, like, you just forget what happens. And it's nice to like remember what happened, or, hey, they're doing great. Like, we don't see that point. We just see sick. You wake up, rinse, repeat, sick again. You got to treat them. You don't hear the awesome stories of they're doing great.
Exactly. I think that's so important to have that closed loop and follow up with your patients, because then you get to see the effect of your hard work and that it really pays off. And I think it's so important. I 100% agree. And it gives you a lot of motivation too. Every time you have a story like that, it makes you more motivated to go in and work and help people. And yeah.
What do you do to like de-stress? I'm sure you get tensed up with everything that happens. Like, how do you find your free time to just kind of unwind from everything?
Yeah, so I think well-being is very important. Like you guys always stress in your programs. So I try to exercise a lot. So gym membership, running. I play in a soccer league out here on the weekends. So all of that really helps. I have my like peaceful spot in my apartment. So just kind of a peaceful area where I can de-stress and have some time to myself. So I think all of that is really important. And yeah, like having a healthy diet, doing all of these things just to stay balanced and feel good and stay healthy and take care of yourself. It's really important.
Yeah, I'm sure here in the U.S., like obesity and cardiovascular disease are number one killers in the U.S. How is it in like Poland? Can you maybe think of like some factors that don't make it as prevalent? Like, is the food different? Like, are people just healthier in general? You think it's more of a genetic component, or is it dietary? Is it more activity? Like, why do you think Poland has less obesity and cardiovascular disease than like the U.S.?
I think the food is definitely it's really good out here. You have a lot of food, fresh markets, fresh farmer markets. A lot of the stores you're gonna have a lot of fresh meats and vegetables and fruits, and all of that is locally grown, a lot of it. So I think that helps a lot diet wise. Although obesity is still a problem here, cardiovascular disease is top of the pyramid when it comes to disease as well. And there's definitely a lot more fast food. KFC, surprisingly, KFC is very popular in Europe and Poland. I haven't seen so many KFCs in my life, I think, as many as here. Yeah.
I feel like I just read your mind. I was just thinking about it. Have you guys like had KFC from freaking Poland or Europe? Like that should taste so good out there. Like even like McDonald's, like the menu's completely different than like what we experience and eat here.
I think it's a Polish thing because I know when I was younger, like my parents never really ate fast food, or they literally never ate fast food, but they would sell for like KFC and Popeyes. They always like their chicken and like they always like the potatoes. Like that's just, I'm not sure if it's like I said, a Polish thing. We just like our chicken more than anything else.
Yeah. They must like it. It's definitely caught on here. It's really popular. So it must be something, people here really like it. So I think that's a big factor.
What's the schedule like, out of curiosity, as you're, doing your internship?
It depends. It's usually work, in the morning, you come in, you see patients, you round, admit patients, do all of that. And then you'll have shifts in the evenings as well, sometimes on the weekends. So it's usually Monday through Friday with some Saturdays, some Sundays, but no nights at the moment. So it's quite manageable at the moment, I would say.
And what about like the language barriers? So you were born in Chicago and everything. So English is your first language, or second potentially. Do you communicate with everybody in English, or is it Polish out there?
It's mostly Polish. You have so everyone, you communicate in Polish. Although most of the doctors here speak English pretty well. So it's really nice to see and to have that possibility as well. We have a lot of tourists as well. We have a lot of foreign people that come in. Speaking of crazy stories that you guys were asking about earlier, we had a patient who was supposed to go back to England, and they couldn't make it because they basically went into alcohol withdrawal syndrome. And they came to Poland, and before the flight, they stopped drinking. And they had this crazy history, alcohol abuse for 20 years of just insane amounts of drinking. And once he stopped for like 3 days, this guy went into full delirium tremens. So he had DT, he had basically had like seizures from AWS, the withdrawal syndrome. His liver was in bad shape. He had jaundice. He was all yellow. We basically had to restrain him at one point because he was not oriented to himself or to the place or to time. He was not aware of his surroundings at all. So we had a crazy case with that, and I think eventually they managed to stabilize him and send him back on a flight. But it was insane. Like, this guy was in a foreign country and he couldn't leave because he was in bad shape. With withdrawal syndrome is you don't mess around with that. It's not nice.
Yeah, AWS is rough. Like,
Yeah.
I've had a few AWS patients, and like anything could happen. Like I've had an AWS patient that wasn't like horrible. He was an AWS, but he like slept the majority of the night. He didn't go all like crazy. It was like low key AWS. Wasn't as exacerbated as some other people. But I actually had an AWS patient that fell on me, and that was probably the worst day of my life being a nurse, because you know how everything's like falling. It should be a nurse-driven protocol. Like nobody should fall. Like but I also can't be in this guy's room all the time. Like I don't want to put him in restraints because he was doing pretty okay. He was starting to be coherent, and I decided taking a step back approach might help him more than like a head-on approach, and that failed. So now I don't fuck around anymore with restraints. I just pop them in.
Yeah.
See, like I had a patient in San Diego, man, that we had him in leather restraints. The guy was in his 30s. He was going nuts, man. He even at one point thought we were trying to kill him. Had security guards in there. He bit off his pick. He got a hold of it. We tried a phenobarbital. We tried Haldol. We tried Ativan, like tons of it, man. We did a Precedex bolus, Precedex drip. This guy wasn't having, so we had to intubate him for that reason. And it's kind of funny because like a month later, I seen this guy at Trader Joe's. He was working the cash register, and I'm like, "Hey, what's up, man?" I'm a nurse. Yeah. I see you in the crazy shape of your life, man. But how are you?
Yeah, probably has no recollection of it happening at all.
Like his hands were shaking. So it's either he was nervous because he seen me, or he was itching for a drink because it's been probably 12 plus hours, whatever the case might be.
Yeah, that's insane. That's crazy that you saw him outside and you had that interaction with your patients like that. But yeah, you probably didn't remember much from that episode.
Probably not. And that's like the worst thing, that like sometimes these people don't learn their lesson, I'm sure you've seen a lot of frequent flyers, right? And it probably upsets you because you're probably trying to like beat the freaking, like, I don't know, you're trying to like teach person a lesson that just like not having it. And you see it again and stuff. Like, do you feel like you try like, because how we talked about the unconscious bias. I wonder if there's like a bias where when you see your frequent flyers more, are you less attuned to giving them great care?
Yeah.
And it's, of course, you're going to say, I always give quality of care, but this is just like, no bullshit. I'm just curious.
Yeah. I think as a young doctor and working, you still have a lot of energy and you want to help everyone and, you want to do your best. But I think some of the older doctors in the emergency room, they see a frequent flyer. They just want to get them out of there and they don't want to mess around. They're like, you're back again. What do you want? And, I'll stabilize you and go home and don't do it again. And they'll come back again, right? And it's a cycle. It repeats itself. But yeah, the older you get, the more you work, it's, you get more, I feel like you get more tough skin and you don't. And you just don't mess around that much.
Yeah.
Patients like that.
You have any questions for us, Luke?
I just wanted to ask you, what's your you have a lot of big plans, I hear, and with your program, and what's the next step with your vlog and podcast?
Yeah, well, we're trying to go to California, or we are going to go to California because we're trying to do like a travel nursing vlog. With that, maybe align with some travel nursing companies, maybe like, we could work together, collaborate. We're also coming up with, we already have already an NCLEX study guide, like a PDF format, like kind of like a book almost.
Okay.
And then we're also working on like Alexa skills. Some people could ask Alexa, or Alexa will ask them questions and they could answer multiple choice questions. Hopefully get that going at some point in time. We're thinking about doing like NCLEX courses. Then we're creating like a more in-depth NCLEX like study guide book. Things like that, just trying to grow in like every kind of nursing aspect for the most part.
Gonna do some live streaming. It's the possibilities are endless, man. It's just finding time and just time.
The key, yeah.
And especially being back home in Chicago, it's like, how like this whole culture thing works where like they expect you to do everything. Like I have technically 3 families like hitting me up for like the littlest stuff, like fix the internet, do this, go with me here. And you're always fighting for time. You're always fighting for focus. And I would love to put more and more time into it. And that's the name of the game. Or make some income and just start hiring people out. Because in order to grow, you have only 24 hours in a day. And you just have to create more tentacles in your arsenal to offload these tasks and the little things that we're doing.
Yeah, that's definitely key. Once you get bigger, you'll have to look into that, I'm sure.
Yeah.
Once you expand.
Yep. Awesome. I thank you, Luke, for joining us. Is there,
Thank you.
is there
Thank you so
Instagram
much,
page you
guys.
wanna, if people want to see more of you, want to interact with you? Is there an Instagram page I could follow?
Yeah, you can give the link at Luke Zborek on Instagram, and there's Facebook and other things that I'm on. So if anyone has any questions about healthcare in the U.S. and U.K. or in Poland and all these different countries, how the similarities, how the differences work out in these places, you can always ask me. And any other health related issues, you can always hit me up.
Diagnosing.
Yeah, sure. Actually, that's actually one thing I forgot to mention. That's the next big thing is telemedicine. So one thing I wanted to say is now we see a lot of patients, especially at GP offices, you have visits via telephone. So the doctor, the patient calls us and they say, I'm feeling bad. I have a cough. This is, it's a wet cough or dry cough. We ask them as much as we can, but because of COVID, half of the patients in like a typical GP office are not seen in the clinic. It's all over, it's via telephone. And that's like the next big thing is telemedicine, video conferences, seeing your patients via video, like a Zoom setting is basically where this is headed. So it's a big field that's expanding very rapidly. So we'll see where that goes as well. So,
how do you like that? Do you think that's a good idea, or do you think it's might lead to some more misdiagnosis? Do you think that's gonna kind of make hospitalization not as frequent, not as necessary? What do you think about that?
I think in some cases it can be helpful because some patients, older people, it's very hard for them to go out of their house and see a physician, see a GP, see a nurse in the community. So it's helpful for those people, and it's helpful to see more patients that way and get the care they need. The one thing I'm worried about is COVID getting so much attention that you have people with silent MIs and people with strokes, that some of them, for example, are scared to go to the hospital. I've heard stories where people have heart attacks and they don't want to go to the hospital because they're scared of COVID. And you have all of these other health issues that are kind of being pushed to the side. So I think that is something that we have to pay attention to, other health issues not getting as much attention these days.
And maybe that's what telemedicine will do, where the person is going to feel comfortable sharing these little things.
Exactly.
And you're going to be able to ask more questions like, hey, if you push down, those that hurt more. And no,
exactly.
Hey, well, then this is not reproducible chest pain. Maybe you should kind of come in. So that would be great. Or I don't know how far in the future this could be, but what if we have these smart toilets where you just kind of like pee and, you get an analysis of your damn urine.
Right away, yeah.
Like, hey, man, your freaking specific gravity is a little bit low. Like, kind of come in or take an extra sodium tab. Like, that'd be freaking sick. I mean, whether it's
amazing. Yeah.
Whether it seems, I don't think it seems very affordable now. Just like I think Bill Gates was trying to work on the first toilet in Africa where I think it takes poop and it makes energy or something.
I don't know.
Yeah, don't quote me on this one, man.
I've never looked into making energy out of poop in my life, but I mean that'd be pretty efficient, I guess. If you could provide like electrical power with you taking a poop in a toilet, that'd be so fucking shit.
Well, yeah, that's the problem in Africa, bro. So I think it was like it costs $100,000 to create this, and they're trying to downscale it, and they're trying to find other people to work with to make these parts cheaper and actually produce an effective toilet for this.
Well, look at like DNA sequencing. Like when DNA sequencing first started off, it cost like tens of thousands of dollars. But then it slowly progressed with thousands, and now you could get it done for like some places will offer like your like gene mapping, not really gene mapping, but like synthesizing your DNA for like hundreds of dollars, if that even like the onboarding of these new technologies is super expensive, but once you get better at making them and get better at doing them and they become more popular, the cost dramatically decreases. It's like the onboarding effect. That's how things tend to work, for everything. Yeah.
It's obviously expensive at the beginning. And then once you have scale and a lot of production, you can make it a lot cheaper. So hopefully, all of this stuff develops. There's a lot of stuff going on in biotech and we'll see. I think COVID is pushing a lot of this stuff forward too.
Yeah.
We have to innovate to get ahead and deal with the crisis, right? So we'll see what happens. There's a lot of stuff going on in the future, so we'll see.
Exactly. All right, Lucas, thank you so much for being here. Guys, make sure to check him out at Luke Zborek on Instagram and Facebook, and maybe one day at his clinic when he's has his own clinic. Hopefully you don't have to go there because then you're sick. You probably should have taken our advice sooner than later, but you never know.
Exactly. Well, it was my pleasure speaking with you guys and catching up, and I wish your show all the best, and I hope you guys keep developing as you go forward and expanding and, you know, getting bigger and reaching more people and spreading your information to nurses and healthcare personnel. I think it's really helpful. I think it's fantastic.
Thank you, Lucas, so much, man. Chat soon.
See you guys. Enjoy your evening.